Okay.
Okay, we are recording. This is Hot Topics with Supervisor Jane Parker on Monday, April 20th.
Thank you, Wendy, and welcome everyone. Just a reminder that when you are not speaking, please have your device on mute. And then if you, as the presentation, as we talk about the updates that we're going to get from the county and Marina folks, if you have questions, please feel free to use the chat feature if you're on the Zoom call. And if we have time towards the end and we have time to take questions, you can raise your hand and I will recognize you and you can ask your question. But it may be easiest to just kind of ask as we go through the chat, and I'll watch the chat to make sure that we raise questions to the people as we go. Just wanted to let you know that even though our physical office is closed to the public, we are open via email and by phone. So you can reach us at the by email at district4, the number 4, at co.monterey.ca.us, and our phone number there is 883-7570, and it's just ringing straight through to us, so your phone calls will be received. I also wanted to let you know that I'm holding weekly meetings with the mayors in District 4, and also my staff is sending a daily update to all of the elected officials in District 4 to keep everybody up to speed. And the county is doing media briefings on Monday, Wednesday, and Friday at noon for the local press. The briefings are live streamed on the county YouTube page if you want to catch them there, and they are recorded so that you can actually tune into them and watch them later if you're interested. And of course, the county's still open for business besides COVID-19. So it's a full busy time for the county. And then this Hot Topics is being live streamed on Facebook and recorded and will be posted at my YouTube channel along with previous Hot Topics. So if you're looking for some late night viewing and listening, there you go. It's right there on YouTube. So we're gonna start with, well, our topic today is kind of largely care and shelter planning. And I thought I would hand it over to Nick Chulos, the Assistant CAO for the county, to talk a little bit about both the care and shelter pieces, and maybe Nick, then you and Lori Medina can focus on the shelter aspect, and then we'll move to Joby Aviation and the Marina folks to talk about the care site.
Okay. Okay.
So Nick Chulos is here from the County Administrative Office, and our Director of the Department of Social Services, Lori Medina, is also here for any questions on the shelter aspects. So take it away, Nick.
Okay, thank you, Supervisor Parker, and glad to be here with you tonight. The county has arranged for, in order to provide shelter facilities for those at risk, the county has leased hotel rooms, motel rooms, I should say, and the basic idea for the use of these rooms is that these are for individuals who are literally homeless or who are, you know, living in a car, you know, in a situation where they just have no shelter. And so that's the first part of it. They're homeless or experiencing homelessness, and they are high risk. And the definition for that is they're over 65 years of age. They have any number of underlying serious medical conditions. The way that the individual would be basically placed in a motel unit is there'd be a referral made by the county health department. A number of these individuals are in what is called the whole person care program. And those individuals would be referred through the county health department to our emergency operations center, and then in turn to a motel unit on the Monterey Peninsula. In terms of other agencies, there can be requests for referrals made by, for example, Department of Social Services or homeless care providers. They could contact the health department if they know of an individual that fits that criteria that needs to be housed temporarily. The ultimate plan is that those motel units would be used for non-COVID individuals or individuals who are awaiting a test result who are homeless and high risk. There are a number of services that would be provided at those facilities, such things as food. There's a security arrangement that's been made as needed. And Lori Medina might want to talk a little bit more about that in a minute. The long-term plan for the county, just if I could get into that for just a minute, is that the motel units would ultimately, once we have the fairgrounds and the King City San Lorenzo Park and a site in Salinas at the Armory set up as alternative housing sites, the motel units would not be used for anyone who is COVID positive. But at the moment, until we've gotten those other larger facilities up and running, which should happen within the next couple of weeks, there could be a COVID positive homeless high-risk person housed at one of the motel units. So that's kind of the overview in general. And I don't know if Lori wants to add a little bit more. Lori Medina might want to add a little bit more information on the service part of it. But that's the arrangement we've got for the motel units at the moment.
Sure, and so this is Lori Medina, the Director of Social Services, and thank you, first of all, Supervisor Parker, for hosting this town hall hot topic, and Nick for the introduction. And so, as Nick talked about, at the alternative housing site, specifically, he was addressing the hotel and motel units, that we will have some limited, we call them wraparound services, that he alluded to. So some of them would include, of course, the housing component, security. So we are finalizing our security contracts for that. The health department, as they are identifying people who are appropriate for these sites, will be providing transportation to and from the site, meals. We will also be doing some basic health screening and behavioral health screening to identify any other needs that people have in our basic intake process. There's a lot of plans that are still being finalized. We are ready to ramp up pretty quickly, but understanding that we have to have safety plans in place. It's important to know that the referral process, the triggering for the referral process, is really through the public health department. That's the entree into the system. They will be identifying people who are appropriate for these locations, and we will coordinate with them and all of the alternative housing sites to figure out which site is appropriate. There will be a code of conduct agreement that has to be agreed to by the constituent, because this is a voluntary placement. And so people will have to agree to adhere to the rules of the facility and the program, about, social distancing, about, the kind of rules of the road in terms of, can you enter or not your room? Yes, they can, but there are rules around that too. And about checking in and out, and about maintaining that social distancing. So there will be an agreement that is signed by the person who's admitted, to say that they understand these rules and will adhere to these rules. Because one of the things about these facilities is that there's not, it is to create social distancing. So visitors aren't going to be allowed. There's no kind of in and out. Once you're in within certain, parameters. Of course, people need to get fresh air. There will be allowances for that, but really, people are not going to be free to just come in and then leave. There is going to be a curfew. So between the hours of 10 p.m. and 7 a.m., people are expected to be in their rooms. They're not expected to have visitors in their rooms. So there will be these rules that need to be adhered to and understood. And if people can't adhere to these rules, we will try to do our best to redirect them through our on-site staff and through security staff to redirect people, to remind them of the rules. But if ultimately people can't abide by those rules, then our obligation will be to provide them transportation back to their location of origin before they came to us. So that it will not be a location where they can just do anything and there's no consequence, because this is a voluntary program. And so, but I do want to just reiterate that we really, really need the community's cooperation, the constituents that are going to be residing in these places, to abide by those rules for everybody's safety, not only the community at the hotel or motel, but also the greater community at large. And so I guess with that, that ends my expounding on Nick's presentation.
Thank you. Thank you, Nick. Thank you, Lori. If there are any people on this Zoom, in the Zoom meeting who have any questions for either Nick or Lori on this, on the shelter options, please feel free to use the chat feature to ask those. And Nick, is there anything else you wanted to add before we move to the care site?
Supervisor Parker, probably the only other thing I should add is that FEMA will reimburse the county for the cost of housing homeless individuals in motel units, 75% of the cost, and I believe there's a provision for the state to potentially pick up part of the other 25%. So that's from a financial standpoint, that's a very good thing. Supervisor, I think you're muted there.
You're right.
There you go.
Yes, there's a good deal of money being expended to kind of get ready for all of these eventualities. So it's really so important that for a certain amount of this that the county can be reimbursed, because it's going to be a tough financial time for us as it is for so many cities and businesses and people. So great. So the other part of this that we wanted to talk about is the alternative care site that is being developed out at the Marina Airport. And before we turn it over to Dan Coughlin to talk about Joby Aviation's role, Nick, did you want to do any kind of introduction to this?
Yes, I would. So going back several weeks, the public health officer and his staff had done extensive modeling trying to predict the potential need for hospital beds in the county, and at the projections are projections, but they do indicate a greater need for hospital beds than what we actually have available. We started working with Natividad Medical Center, Dr. Walls, the chief medical officer, to try to determine how big a facility would we need. And the estimate was around a 60,000 square foot building, ideally with an open floor plan with the ability to set up essentially a field hospital in that kind of an environment. So we started looking around. We were having a difficult time coming up with anything that really fit the bill. And then incredibly fortuitously, we were approached by Lane Long, the city manager of Marina, and Joby Aviation, Dan Coughlin, with an opportunity to use a facility that is under construction now. And it couldn't be more fortuitous. And Dan can talk more about it, and I'm sure Lane can talk about it, but it's the right size, it's the right level of flexibility, and we've got a team working very intensively on getting that up and running. And I think it would ultimately be about a 350 bed facility, literally a field hospital. So that's kind of the overview. That's how we got to where we are right now.
Thank you, Nick. And yeah, so Dan Coughlin is with Joby Aviation and has really been a key um, facilitator and instigator of us being able to find and convert a site into a field hospital, which there wouldn't be many locations, I don't think, in our area where something like this could happen. And we're just
Right.
so pleased that you are part of the team to make this possible. So if, Dan, if you want to talk a little bit about how it's going from your perspective, that would be great.
Fantastic. I'm going to share screen here. Can you see this okay?
Yes.
Oh, fantastic. Great. And Lane or Bruce, if you want to jump in at any point, please feel free. You were really the kind of the folks that got this going. So my name is Dan Coughlin from Joby Aviation. My title is Manager of Special Projects. I work directly for the CEO of the company and manage critical path issues and critical issues for the company. And I've got a business background, a technical background, and kind of can span those two realms to help build Joby from what it is now, which is largely a prototype, large-scale prototype company, into a full-on production company. I promised Wendy that I'd try to keep this to around 5 minutes, so I will.
Oops, we've had a Zoom freeze, it appears.
Yeah.
And designed and built what's called an eVTOL, an electric vertical and takeoff and landing vehicle. So this is a 6-rotor, 4-passenger, 1-pilot aircraft. And this is a real picture of a vehicle that we're currently in flight test with. It takes off vertically. It's extremely quiet, which is really the trick to having this type of flight. And so it takes off vertically. It transitions into an aircraft, flies at a very good clip, faster than a Cessna 172, reaches its destination, and then lands vertically. And so the business case for this is as an air taxi. We plan on making literally hundreds and hundreds and hundreds of these, and then deploying them in cities where we'll also be building vertiports, using existing landing pads. And the future is, to convert rooftops into vertiports for rapid transportation. So imagine driving from San Jose to San Francisco. At any given time, it can be a 2-hour drive. This will get you there in 12 minutes. And so it's like an Uber type of service that we're envisioning. We are working very closely with the FAA right now on certification of this aircraft. This will go through one more iteration. So what you see here will probably look very similar to its final configuration. We're learning about the vehicle in our flight test, and we're learning ways to make it more efficiently and lighter and more cost effectively. And so we will go into certification with the next version of that aircraft. We expect to begin full-scale production of this later this year in Marina. And so let me go on to the next chart. So as I mentioned, we have a facility in San Carlos that does our batteries and our motors. And then our main headquarters is in Santa Cruz. We currently have around 300 people in Santa Cruz right now, and working on 2 different phases of the aircraft. And then we've got a team of people that have been here with Bruce and Lane and the whole crew in Marina for about the past 18 months, building a presence here, ramping up to what will be our production. Currently we have in Marina, this is a 10,000 foot view of the Marina Airport. We are leasing this facility here where my cursor is moving, where most of the large scale composite parts will be made. We make every portion of this aircraft other than the tires, the windscreens, and the avionics. Pretty much everything else is hand built. And we've recently leased this building, which will be our flight test hangar. And we lease, where I'm sitting now in this building, it's a large hangar that all this was built by the Army in the 70s, 80s, and earlier. and we're leasing half of this building. This will largely be our additive manufacturing facility that we literally are printing our metal components. As I was telling Jane and Wendy as they visited a few months ago, I'm not exaggerating when I say this marina will have the most advanced 3D printing operation in the country in about 3 or 4 months. We will be cranking out metal parts for our aircraft in a matter of months. Where I'm looking now is, this is not a very good rendition of what is the tent, but it's a decent scale, and it's a 55,000 square foot fabric facility. So all the components are made in these buildings here, and we will be bringing in the components to the south end and go through an integration process where we assemble them all, put in all the avionics and wiring and all the systems and landing gear, and then out this end we'll spit full aircraft. And those will be lightly tested here, but then move over to our flight test facility here, where they'll undergo full-on flight certification. So all this is geared up. We are really wanting to start in June, start manufacturing components here. With COVID, we're allowing ourselves to delay that a bit. And so it occurred to us, it could be used based on what China was doing and what we knew was happening in Wuhan, how they were really seriously isolating people, identifying them, testing them quickly, and then isolating them. I mean, they were taking family members away. There's no family visiting there. They took, pretty extreme measures. And so, this being a secure airport facility, there's fencing all around it. There's aircraft access. There's, plenty of space here adjacent to the tent. It did occur to us about a month ago, probably longer, that this tent could be used. And then it was Tuesday before last, as Nick mentioned, we approached the city with the idea. This lane, went to the county, and then a few days later, we had a full contingent from the county here, kicking the tires on what was a kind of a rough frame at the time. Just a quick look at the future. So this is the tent that we're building now. The Marina Planning Commission just recently approved the construction of a 580,000 square foot facility. And this will enable us to crank out about 250 to 300 aircraft per year. We just closed our Series C. Our big partner is Toyota, which is great because they're experts at mass scale manufacturing, and they're closely advising us on the kind of the layout and the build of this facility, which we're in the later phases of the design of this now. We actually were prepared to break ground and just about to submit a grading permit for this facility. It's really difficult to imagine how large this is. This will be the largest, I think, facility in the county. I could be wrong. But we hope to have that built by the end of 2021, and then starting to build aircraft in there. So again, Wendy, I'm sorry for taking so long. I'll go through this quickly. This is the tent as of probably an hour ago. They are putting on these covers 20 feet at a time. They can go as fast as an hour per 20 feet, or sometimes it takes a little longer if the wind's blowing. As this tent crew is building it, we've got our guys and folks out there hanging lights, hanging electric wire, doing groundwork, getting the infrastructure in. What was supposed to be a 2-month build, we've compressed into 3 weeks. And we hope to turn over the keys on May 3rd to the county. Any relief on that, by the way, Nick, if you know, and as you know, it's going to be May 5th or May 7th, or that helps us. So just keep me posted, because the more time we have on that tent, the more capability we can put in there for you.
Okay.
This is just roughly, so we've provided this rough map to the county or emergency response team, primarily Michael Jorgensen, who is quite an expert in infectious disease, and he's laid out the interior of this tent, and Jane heard it earlier, the kind of cold, warm, and hot zones, and all the associated protocol of going in and out of these zones, and the pathways for medical personnel and for patients. And we can assist with that as well. So not just get the tent up, but we can, depending on how the county wants to work, we can build these interior walls and visqueen and plastic walls, and there's vestibules and stuff on the inside, and we're more than happy to help with that as well. The county's already starting to deliver hardware. We're expecting that, there'll be a lot of increased traffic here, which is great, plenty of room. We've given you the code to the gates, and so there's really no need to inform us. I think Mike Durr was, sensitive about it. I told him the site's his. There's plenty of room out there. We're not going to get on top of each other anytime soon. Toward the end, if you're moving in beds and stuff, we'll work all that out, but I don't foresee any issue. Just kind of when I get off the stage chart, we're looking to get the facility to you in 2 weeks. It'll be secured, covered. We'll have water and sewer, power. We can always do more power with generators if we need to. Michael Durr is already on that. We can provide data, although I would recommend the county contact Redshift. They're just down the street, and they can provide you a microwave link. If not, we can do it. And we're hoping to get you HVAC, although there's probably a more temporary solution that would be a little bit quicker to get you heat and positive pressure that's required in the safe zone or the cold zone. And then just so you know, we're going fast out here. My CEO is extremely concerned about the safety of our employees and the safety of the folks out here, both COVID and also just general construction safety. Our safety officer is here almost every day. We've got, protective PPE. Marty and I, Marty's the superintendent, try to set a good example. We're wearing these, religiously, and washing our hands, and keeping everyone hydrated and safe and harnessed. And so knock on wood, no one's even cut a finger yet. So that's it. We are super stoked to be in Marina and Monterey County. Really, this is our honor. This makes, it's really inspiring the company. We're giving them every 2 days, we're giving a full company-wide, status on, on the build of this and how we're going to turn it over. Everyone in the county, in the company is cheering it on, and it's a really good, warm, inspiring thing for our company. So we're just pleased to be part of this. Jane, I'll turn it back over to you.
Thank you so much, Dan. We're just excited about Joby being here and the aircraft that you're designing. But this added partnership is just a real treat, and you've just been so responsive and energetic and professional, and just really great working with you. And to turn a 2-month building project into 2 to 3 weeks is pretty impressive. So we appreciate it. And the timing, they're kind of, the projections, the models that we have so far, if there is going to be a surge that really fills up and surpasses our hospital's capacity, even with their surge capacity built in, the timing is probably going to work out just right. So we're hoping to not need it, of course, but thank you so much for helping us keep our, our residents safe and to be able to provide the healthcare that they may need. So I want to turn it over to Mayor Delgado. We are getting some great questions on the chat and through Facebook, so thank you very much. I'm keeping track of those. I do want to give Mayor Delgado a chance to talk a little bit about this from the perspective of the city of Marina, and we'll get into some questions after he has a chance to speak. So go ahead, Mayor Delgado.
All right, thank you, Jane. And I hope that maybe some of what I say might answer some of those questions. But first, I want to say thanks to you and everyone at the county for working with Joby, and for Joby doing the bulk of the actual labor and planning for the labor to happen, the construction. It's really a good team effort. And Lane Long, our city manager, and Dan Paulini, our chief building official, he's out there, I think, almost every day. And so the city and all the city staff that need to be involved are doing everything they can to be part of that success. And it's a really feel-good team effort in a crisis. It's just doesn't get much better than this. And the final product, as you see in those photos that Dan Coughlin showed, it's really a beautiful structure as well. It looks really just a fantastic A1 structure, which is supposed to be, or planned by Dan Coughlin and his group, operational for county turnover, county use as of May 3rd, which is timely because it's my understanding that based on modeling, the Monterey County health officer is predicting or is estimating the surge to hit in late May, early June. So if it's operational for May 3rd, that gives the county a little bit of time to get things in that they need. It's going to have 350 beds, and Chris Walls of the Natividad, the chief medical officer, told me today that the first iteration would include 100 beds, and then if they're needed, they could bring more in. It's always been envisioned as a low acuity medical overflow. So it's overflow from the hospitals when they have as much as they can handle. And the low acuity refers to less serious cases, in this case, of COVID patients. So these would be individuals who are COVID positive. They would be stabilized in their status of COVID positivity, and they would be also perhaps recovering from worse conditions in recent past. So stabilized and recovering patients, and those patients that are showing symptoms but are waiting for their test results would be the kind of patients that the hospital would send to this location as a contingency should it be needed. The site was a really good site because it's got security provided by an airport perimeter fence. It's isolated from all homes and businesses in Marina. So that's really part of the ideal location, but it's also, like most of Marina, centrally located between Chomp and the Salinas hospitals. So there'll be fairly convenient transportation going back and forth as needed. There's only been 25 hospitalized cases in the county so far of COVID. And with the hospitals having a capacity of somewhere around 550 to 600 beds, if they were to need those for COVID cases, you can tell that the surge has to be pretty great to go from the 25 hospitalizations we have now up to the several hundreds that our local hospitals can cover. But if the worst case projections happen, or those that are most likely, we might need 900 COVID beds. So let's say the county hospitals are given 550 beds to COVID patients. These 350 beds in the city of Marina would be crucial to meet that 900 total. So that would be an important contingency for this to happen. But again, like the sheltered housing sites at Monterey County Fairgrounds and the San Lorenzo Park in King City and the Salinas Police Activities League building, it's hoped that none of those will be needed, and it's possible that they won't. But as contingency goes, it's really great that the county has the organization to have located these, and they're moving as fast as they can to get them ready. But that's all I had. And Lane Long has been our point person as far as making everything happen. Lane, did you want to add anything?
Be sure to unmute if you do.
While he's coming on, if he comes on, Jane, just another thank you to you for having these meetings. Appreciate it. And thanks to Nick Chulos for doing so much to give us information, and all the other county staff, including those on this call today.
Thank you, Bruce.
Mayor, I really don't have anything else to add other than if you go out there and site, this is really a lot of people working together to achieve a really good goal for the region. And our hats off to the county for working with us so well on this issue.
Thank you. Well, we certainly appreciate the city of Marina, working with us and bringing this to our attention. It's just really, it seems just an ideal coming together of circumstances. So we're really excited about this. And let's see, let me get to a couple questions here. There was someone from who's watching on Facebook asked whether this was going to be for COVID positive patients, and it now appears that yes, it is. This will be a place where people can come if the hospitals become too full to be able to handle their care, they would come to this location if they are in need of care, and but not so serious that they would be in ICU. If they're on a ventilator, or they're in a kind of a more extreme situation like that, they would stay at the hospital. But if they're just needing care to recuperate, this would be the place where they could come. And it's really interesting to hear the medical people talk about how they sort of cordon off the different sections of the facility so that there isn't contamination. It's really we're so fortunate to have Michael Jorgensen, who has worked with Doctors Without Borders and helped to set up these kinds of infectious disease tents in places like Haiti and Africa. And so there's someone who really we can have confidence that they really know all of the different sequencing and the different steps and how to conceptualize it. So I think we're really fortunate from that perspective. We did have a question earlier about some of the things that Nick and Lori were talking about. A question about whether what if some of the cities don't want to participate in the motel room option. And I guess I'm inferring from that question, what if a city where the motel is located doesn't want to provide that service, I guess. I think that's maybe what the question is. Have we had a problem with cities not wanting to participate?
Supervisor Parker, no, not that I'm aware of. We've been looking for available motel rooms really throughout the county, because for example, we're looking in the King City area. I believe our EOC team is looking at a motel there. We're looking in Salinas, we're looking on the Monterey Peninsula. The idea is to try to keep the occupants more or less in the area that they reside in the county. But we haven't had any objection from the cities about using those motels. But frankly, I have to say, it's been primarily a matter of us approaching the motel operators. And I think they're anxious to get some of the revenue that they have been losing by having the shelter in place operational. So far we haven't had a problem with that. I hope we don't.
That's great. Well, and I think part of what can that people will have concerns initially, I think, at the thought that people who have been exposed to the virus or who may test positive are going to be in their community. It's a normal concern, I think, for people to have. But as they learn more, I hope, about the security measures and all of the considerations that are being put in place to keep both the person at the motel and the surrounding community safe, and that we start to do this, and it's shown to be safe. I think
and that's a really good point. Our we're working with a group of county and other agency staff to really put together a comprehensive and thoughtful plan about how these units would be operated, exactly for the purpose that you just described, so that we can cover the contingencies that we need to cover. So
thank you. And I know that the mayors of the various cities are very interested in making sure that they have the accurate information, the talking points, so that they can be part of the communications mechanism to help reassure the residents.
And Supervisor, I should say, we are working to put together that kind of information so that the public has a more comprehensive understanding of how this all fits together. So
yeah, it's there are a lot of moving parts, so thank you for continuing to work on all of that. Another question that came through the Zoom chat was a question about what kind of shelter is being envisioned and contemplated for hospital workers who may you know, be concerned that they are being exposed to COVID positive people and may not want to take themselves back to their normal living situation. Do you want to talk a little bit about some of those considerations?
Well, I don't know that I have any definitive answer for that really as we speak. I believe that the hospitals, because the hospital, that's their workforce. I believe the hospitals are looking into that, but I don't have any real definitive information about that tonight.
Okay, yeah, and the only thing I've heard is that as it relates to the alternate care site out at the Marina Airport, that CSUMB has offered to make dorm facilities available to any of the workers who might need a
That's
place.
accurate. You're right about that.
So that could play a role there. Let's see. And someone had a question about the actual Joby Aviation airplane thing, whether people were lining up to purchase those. And Dan, you clarified that on the Zoom chat, but in case anyone on Facebook had a similar kind of question, maybe you can talk a little bit about that.
For sure. Just for a second. So they referred to it as a drone, and that's not completely inaccurate, although our vehicle is piloted. And there's not much preventing us from actually making the vehicle autonomous. But just to get through FAA certification, we are, you know, have a pilot in the vehicle. We don't intend to sell the vehicles. We will build and operate them ourselves, and they'll be an air taxi service. So we've got, in terms of folks lining up, we've got numerous cities across the globe actually that that we've been in discussions with to, you know, begin operations when we are, you know, when we are through our production phase.
And could you, just for people's curiosity, how many people can be transported in one of the vehicles?
Good question. It's a 1 pilot, 4 passenger aircraft.
Thank you.
Sure.
Great. Well, we still have a few minutes. If people have questions, if any of the people on the Zoom call have questions and they want to, if you have access to the raise hand feature, you could do that to ask a question, or of course continue on the chat. Okay, there's a question on the chat about what the projected cost might be per ride. Is it like per mile? Do you have an idea of what that might cost?
That's another good question. It's largely going to depend on how many, you know, how fast we can build them. The more we build, the less the price will be. We're targeting on our initial release of the vehicle so the price of, let's say, San Jose to San Francisco to be the same as an Uber ride. That's our goal.
That sounds pretty attractive.
Wendy, can I mention, Jane, can I mention 2 very small items?
Sure.
I erred in calling Craig Malls, Chris Malls. So I just want to make sure I got the chief medical officer's name correct. I'm sorry for that error. And I wanted to give a shout out to Wendy Root, Askew, for being a point person from the county and your office, getting all the information she can as fast as possible to our city and other cities around the county, especially in your district. So just a shout out to Wendy, and thank you.
Thank you, Bruce. Yeah, Wendy is a remarkable force of nature and really makes sure that as we learn things, that information gets posted, disseminated, and she's really the driving force behind these virtual town hall meetings and making sure that we're making as much of the up-to-date information available to as many people who want it as possible. So thank you. Yeah, it's great working with her. Let's see. We have a few more minutes. I'm trying to think if there's anything else, Nick, from just the general county updates. I guess people may be aware that we now have 141 positive cases of the virus. They're split pretty much seems by population, about
Mhm.
half of the positive cases are from the Salinas area, and the rest
Yeah.
are distributed geographically. We're also getting the ethnicity information,
Mhm.
and I'm hoping Nick can maybe, it was so handy when people could sign up for the daily situation
Oh,
report
yeah.
and
Mhm.
receive it as an email each day and get all this information. Maybe
Yep.
you can give an update of where we are with that and where
Yeah.
people can find that information in the meantime.
Yes, I was made aware by your office actually late last week or middle of the week that subscription service, if you want to call it that, had been discontinued. And just before we got on this call, I was talking with or communicating with our public information officer. She's going to get back to me about what we can do to reinstitute that. It is obviously a valuable service, and I had understood there might have been some technical issue or technological issue, but we're going to get that fixed and be able to do that, provide that service again. And Supervisor, one other thing I might say is that individuals who are following the meeting tonight, there will be a presentation to the Board of Supervisors tomorrow about the alternate care sites and the alternate housing sites. So there'll be another opportunity to hear more information and perhaps hear questions that the public might have through the Zoom feature at the meeting. So
Great. Thank you. I stand corrected. I said there were 141 COVID positive cases. The latest information that has just come out is that the new number is 148. So where shelter in place is working, and we still are seeing transmission. There's a question about great weather being projected for this weekend, and how are we doing in terms of monitoring the beaches and probably the parks. I know from my own personal viewing of the beaches, I do see people out there, but they've been very good about keeping that social distancing. And I think maybe Nick, you can comment on the county parks. I think and Fort Ord, I think we're seeing similar compliance there.
yeah, that's our understanding that the individuals have been where they've been at those facilities have been pretty good about observing the social distancing and all of the precautions. We haven't encountered any real problems that I'm aware of. We have pretty daily briefings from our sheriff and our parks department, and at the moment I'm not aware of any major problems with that.
Great, thank you. And we do have a message on the chat saying that their business is in Moss Landing, and they've been seeing quite a number of people coming out to Moss Landing, and that they've had people congregating, and sort of wondering what can be done to prevent people from coming there and gathering.
Well, Supervisor, my understanding in the way the sheriff has been approaching this is if people are aware, for example, let's say there's a large gathering that appears to be violating the shelter in place requirements, the sheriff has dispatched deputies to basically instruct those people to desist. And it doesn't sound like that's been met with a lot of resistance, but they have had to go out and remind people, and they're willing to do that as they become aware of a problem that might be existing out there.
Okay, it sounds like it may be something that crops up more on weekends, but yeah, definitely if you see gatherings, I mean, this person mentioned, about between 15 and 20 people, hanging around, drinking, and that would be the kind of thing you'd want to call the sheriff's office and report. And
right. And my understanding is they would dispatch someone out there if they were notified of it.
Great. There was a question from Facebook about what model is being used to show that surge in late May, early June. You can find the presentation that the public health officer made to the Board of Supervisors where the slides show those projections. That it's archived. It was the April 14th board meeting. You can find it there archived. Also, if you go to the county website and click on if you go to just the Maine County website, a big coronavirus thing is there. If you click on the link there, it'll take you to the health department's webpage, and there also is a copy of that presentation. Maybe I don't know how easy it is to find, but it's and actually, I don't know, maybe Wendy, I happened to take a picture of that slide because I wanted to be able to look at it. So we may be able to find a way to post that so it's easy for people to see what we're talking about, or a couple of those slides. But it's a model that was developed, I think, out of the University of Pennsylvania, and the local, our local public health people have tailored it to our situation here in Monterey County. So they're thinking that it's as close to our experience, or what we will experience, as possible. But they're monitoring it all the time to make sure that it stays close to reality.
And Supervisor, the other thing about that model that's interesting is that it allows for assumptions to be made about level of compliance with a shelter-in-place order.
True.
Which makes it more accurate, really, for our situation here.
Mm-hmm. Right. Let's see. Oh, to report people possibly violating the shelter-in-place order, what kind of phone number should people use? Do they call 911, or do they use a non-emergency number?
There's a non-emergency number that is part of the dispatch operation. I can get that number and we can get it posted. As I don't have it right in front of me right now, but I can get
okay.
that number.
That would be great.
Sure.
Then we have another question about what the county's role might be in the possible closure of Loch Padden Park in Marina and the Marina Dunes Preserve. I guess KSBW had reported that the Marina Dunes Preserve is closed, and I don't know about that. It depends whose park it is.
Right.
But I don't think in our area, most parks and beaches are still open. The only things that have been really closed have been parking lots, to avoid that clustering of people and the inability to keep the 6-foot distance. But as far as I know, for hiking and biking, the Monterey Regional Parks, the city parks in Marina, the county parks are available, as long as people are honoring the social distancing requirements. Let's see. Okay, the sheriff non-emergency number is 755-3700. So that's terrific. Thank you, Wendy, for making that available on
Excellent.
the chat.
That's good.
We have a couple of minutes, and Mike Jorgensen, who is he's at CSUMB, but he is the person that I mentioned earlier who has done have set up these kind of field hospitals in foreign countries to deal with infectious disease outbreaks. And Michael, do you want to just take like a minute to talk about some aspect of that people might not have heard just in the arrangements that we're making for the Marina site?
Sure. I apologize. I don't know why the camera is not working today. It was working great yesterday, so I apologize. But yeah, basically, sorry for coming in a little late. I just saw the link, so I'm not sure how much you got into the details of the ACS, but just very briefly from my side of things. My background, for those that are familiar, is I spent 4 years for Doctors Without Borders, working in conflict zones and remote areas all over the world. Before that, I spent 5 years in the military with a shock trauma platoon for the military, setting up field hospitals for military trauma cases. And then I also did a contract for the State Department for some projects in Africa. I was asked to come aboard just to assist with just from my experience in terms of developing field hospitals. Just a very quick overview as to our goals for the alternate care site. Basically what we're trying to do is traditionally when you're working on an outbreak team, specifically I'm referring to my time with Doctors Without Borders, I specifically was exposed to some cholera outbreaks. Doctors Without Borders tends to manage those almost identical to an Ebola campaign or Ebola response. So what our proposal was to run this and set this up following the general model of an Ebola cholera campaign, just because the risk of contamination and contracting it is just so high. There's definitely caveats that make it a little bit different, but the core fundamentals are the same. And I think it's probably already been touched on, but our goal, the way I explained to people with the alternate care site, our goal is to take in COVID positive patients, however, they are stable. So these are not critically ill. These are not people that are on the ventilators. These are people that we have deemed through a criteria amongst the other 4 outlying hospitals that they are quote unquote safe to be transferred to us and are considered stable. Nevertheless, we're still going to run it in terms of a high risk contamination. The way we traditionally do that is running, basically setting up what we call a cold zone, a warm zone, and a hot zone. Basically, a cold zone is where all of our staff are functioning and setting up, and they're through a gate system. We enter and exit out of what we call the warm zone and the hot zone into the facility, which is where the patients are. The difference between a warm zone and a hot zone. Warm zone is traditionally for when we're ruling out Ebola or ruling out cholera, and the person is awaiting some tests to hopefully be discharged. But should the test come back positive, we then immediately transfer them into the hot zone. The reason that's important is because no patients enter through the cold zone. They always enter through the warm zone through a triage system that we're setting up. Dan Coughlin has been very, very immensely helpful in setting that up. And they will enter from the warm zone and then proceed into the hot zone if necessary. One thing that's interesting is—
Sorry, Michael, we're out of time. So I'm afraid if you want to finish your thought there, and then we'll wrap it up.
No, that's about it. I can get very involved in it. But just as long as people, when they hear the term about the alternate care site, they understand that the goal is to have stable COVID positive patients, and that we do have a system in place for the severity of them, and just our process and our mindset behind how we're setting it up. As long as the people understand that, that's kind of the plan.
That's great. Thank you so much for being here. And we did mention earlier, and the people who are listening can clearly tell that this is someone who knows what they're doing in terms of setting up a facility like this. So we are, again, as I said before, we're so fortunate to have you here, Mr. Jorgensen, to help us get this set up and to do it effectively and efficiently and right the first time. It's really great. So I want to thank everyone for being here, the county folks and the city folks, and Dan Coughlin from Joby Aviation. I do want to mention that if you want to get media briefings and see the presentations to the Board of Supervisors, there's a link in the Zoom chat, and it's basically the county's YouTube channel. So again, my thanks to everyone. If you have any additional questions that haven't been answered, send them to district4@co.monterey.ca.us, and we'll get those answered. Join us next Monday for another Hot Topics, fascinating subject to be determined. And between now and then, if you haven't done it already, take the census. It's fast, it's safe, and it's important for our area. So stay safe, everyone. Be kind. See you next week.